Our last speaker of this session is Dr. Vivian Lou. She is the Associate Professor of Department of Social Work and Social Administration, the University of Hong Kong, and Director of Southport Center on Aging. Her research interests focus on family gerontology, in particular family caregiving for dementias, stroke, end-of-life care, and social adaptations and mental health of Chinese older adults and family caregivers. Dr. will share with us the topic, Making Meaning on Dementia Caregiving, a Generation's Perspective. Dr. Lou, please.
So thank you very much for the conference. I'm very honored to share with you part of my study that supported by the GRF on the meaning making on dementia caregiving, generational perspective. It is just a coincidence that the whole data collection period actually covered some of our respondents participated before the COVID-19, and some of our respondents participated after the COVID-19. So we actually captured this opportunity to do some analysis so that we can understand more about how COVID-19 would have an influence on the meaning searching process of our caregivers. So I will share 4 topics. One is on dementia caregiving, then it's on meaning, and then I will do some conclusion and provide some of my reflections on the possible implications. About dementia caregiving, we all understand, maybe from the previous speakers, you understand that how dementia caregiving would be challenging in the community and also in different care settings. And now it is estimated that we have over 50 million people living with dementia, and the prevalence rate in Hong Kong is about 5 to 8%. And for the caregivers, most often they are female, and then this would provide a very high challenge on the enduring stress and frustrations. It is quite understandable that dementia caregiving could be a very, very challenging demand for family caregivers. Most often, we would say, okay, they are very much under high burden. So what are the impact of high burden? High burden actually would be associated with poor outcome for caregivers' mental well-being, poor outcome for dementia patients, such as the quality of life, maybe our possibilities of being abused, and also poor outcomes for families, such as the conflicts, such as decrease in social support, and also the reduced social life. So basically, when a person is triggered by a stressful life events, what they are going to do. Of course, they were seeking or supported from others, seeking information, and also maybe change their behaviors, and then maybe also try to do something different so that they can cope with such a challenging scenario. And one of the things people often will do is searching meaning. What does it mean, searching meaning? That means they'll go through a very cognitive and emotional process by assimilation or accommodation to figure it out. So what does it mean to me? You know, how I can make sense of such a demand. So this process is found to be very interesting, and also recently moved into the academic lens. When we study the meaning, we have to think about 2 scenarios. One is about this, we call it situational meaning. And under that, there are 2 categorical meaning-making process. One is people may feel, okay, this is really a loss. You know, I lost my previous habits, I lost my previous time, I lost my previous relationship with my care recipients, and then feel powerlessness or hopelessness. So this is a part of the meaning-making process. It's quite sad, but this is true. And then it is about provisional meaning. That means people, on top of feeling sad and hopelessness, people may feel, okay, in the day-to-day and communication through this process, I can find something maybe more positive, feeling more confident in handling certain caregiving tasks and having subjective experiences that they can change the scenario, they can bring happiness to the care recipient's life, or even bring peace and harmony between themselves and the care recipient, so that this would have a positive impact on caregivers' well-being. And on top of the screen, you can see that this situational meaning is actually relates to a global meaning that means more fundamental or more intrapsyche or more lifelong, that has already been developed maybe from your childhood or maybe from our culture, from our context, from our society. So under this lens, we might assume that, oh, would there be any difference if we take a generational lens? Because we are, when traditionally we talk about generation gap, now we talk about generation crisis. Because for me, I would have a different belief, different goals, different subjective senses as compared to those who are maybe 5 years younger than me, or maybe 10 years younger than me, and maybe 5 years older than me. So we will have some kind of generation breakdown in terms of understanding the real life experiences. So that lens brings us an attention and assumption on the possibility of a generation model or generation perspective on making sense of caregiving. So our objective is to investigate differences of meaning-making in dementia caregiving between the baby boomers and the Generation X. So for the baby boomers, it refers to those who were born between 1946 to 1964. And for the X generation, it refers to those born between 1965 to 1980. And our second objective is to test the COVID-19, whether before the COVID-19 and after the COVID-19, whether there's any differences on these generational effects. As I shared, this is actually a coincidence because this has just happened. So our study is not purposefully designed for COVID-19, but we just can use some of our data to test these hypotheses. This is a longitudinal survey. We are now in the middle of the process. So what I'm going to share today is just a cross-sectional and also part of the active data set analysis. And our inclusion and exclusion criteria is, first of all, the Hong Kong residents birth between the 1946 to 1980, and also providing assistance to at least one parent with dementia on ADL, IADL, not less than 8 hours per week in the 3 months period to the study, and can speak Chinese and voluntary participation. We measure, of course, first of all, the generation, and also situational meaning, and also provisional meaning, and also depressive symptoms, dementia caregiver, caregiving needs, and the demographics, and also care arrangements. And we just use part of the data to formulate today's study. So our active sample consists of 338 baby boomers of adult children, dementia caregiver, and 263 Generation X. And our procedures of data collection, actually before the COVID-19, we were doing face-to-face data collection. But after the COVID-19, we quickly shifted it to online, telephone, so it is a very hybrid mode, multimodal data collection processes. We have done some sensitivity analysis and found our data are still very valid. So if you look at this, you can see that actually boomers and the Generation X, they are significantly different in terms of education, which is very much expected, and also the housing condition, and also the work status. I'm really sorry that my eyesight is not that good for me to figure out the very small, heavy PowerPoint. So, and then for the care recipients, also, you know, as expected, because the boomers, they are actually senior than of the X. So they are taking care of less, I would say it's less male, and the Generation X are taking care of more males. And then their ADL and their IADL status, it's a bit different as well. And for the care arrangement, the boomers are much more likely to be the primary caregivers, and the weekly hours of caring, the boomers put up more hours to do, and the spouses, yes, the boomers are much likely to be, let me see, the spouses, yes. And it is observably different that the Generation X is less likely to be the daughter-in-laws. So then let's look at the COVID-19. If you look at the boomers and Generation X and its difference on the depressive symptoms, you can see at the left-hand side, the Generation X are a little bit more, I would say, likely to feel moderate to severely depressed as compared to the boomers. But after the COVID-19, when the participants, they joined our survey after the COVID-19, you can see the both of the generations, their depressive symptoms likelihood increased significantly. You know. And then if we look at the meaning-making process, you can see that actually the boomers are less likely to feel sense of loss and powerlessness as compared to the Generation X. And there's an interaction effect between the generation and the COVID-19. That means as compared to before the COVID-19, after the COVID-19, the Generation X are more likely to feel powerlessness and the sense of loss. That is the one of the situational meaning making. And for the provisional meaning making, you can see that that is the baby boomers are more likely to feel higher levels of professional meaning making, and this was not interacted with the COVID-19 period. That means regardless of before COVID-19 or during the COVID-19, this positive aspect of meaning making does not make any differences. The only difference is the generation difference. And in terms of the meaning making and the depressive symptoms, you can see that for the powerlessness side, for people who feel more powerlessness, high level of loss and powerlessness, they're more likely to feel depressive symptoms. And if they feel more professional meaning, they're less likely to feel depression. So the conclusion remarks is, first of all, there is a generation lens that we should pick up or we should pay attention to when we are designing any policy framework or services or programs targeting dementia caregivers. And then under the COVID-19, the Generation X caregivers were more likely to be affected in terms of the experiencing of loss and powerlessness. So this is the lesson learned. Then what are the potential implications for our services? And I have conducted quite a lot of study on caregivers, so I advocate for a responsive strategy in terms of designing caregiver policy framework as well as caregiver supporting ecology. So after today's study, I would advocate that we want to be more generation responsive in designing the caregiver support systems. We have to differentiate those adult children caregivers, whether they belong to the boomers generation or the X generation. The X generation, they would be more likely to be working, and so that a balanced life, meaning making that try to reduce their sense of loss would be much more important. So under this caregiver support spectrum, and I will highlight two possible implications based on my study. One is on the resources information corner, one is on therapeutic interventions. In terms of the resources information, and how we can reduce sense of hopelessness and increase or enhance the sense of hope. One of the things, according to literature, that we can do is to share with the caregivers what are the possible trajectories of a caregiving journey or a life of a caregiver, from a starting point to adjustment, to adaptation, to stabilization, to end-of-life care, and then to the exit. So if we can actually map it quite clearly, and the caregivers would be less likely to feel hopelessness and powerlessness, which is very important, because according to our study, about 23% of our Generation X caregivers, they reported they are, during the time of the survey, they haven't adapted to the role. That means they are continuously struggling. What am I going to do? You know, I don't know what to do. What are the appropriate arrangements, this and that. That is very harmful, because the adaptation is a very important signal for the caregivers to settle their balance in terms of their multiple social roles. And of course, for those who are really feel very hopeless and they wish to seek therapeutic understanding on that, and we have a full focus of hope duration, hope-inducing therapeutic intervention that could be introduced based on literature. The 4 steps including how to finding the source of meaning and acknowledge caregiving identity, and then reflect on the life experiences and creating the meaning for present and the future. That means create a meaning of what am I doing in terms of taking care of my dementia parents or dementia relatives. And then at the third stage, we can introduce a little bit of the embracing appreciation activities. And at the last stage is to experiencing the new life meaning and then get feedback. So this is something that has published by the literature on how to enhance hope. So wish that we could have chance to work together to bring more hope to our Generation X dementia caregivers joint-handedly. Thank you very much.